Hello, everyone. It's a pleasure to be here with you in this lecture. Uh, we're going to talk about preservation of fertility in men. I am Jorge Rincon, urologist from Insert Group, Medellin. Male fertility is a complex issue, but there is hope. With early diagnosis and treatment, many men can have healthy children. 50% of the world population has trouble having a children. And infertility is caused in 50% of the cases for factors attributed to men. This could cause consequences in self-esteem, in mental health, and financial status, relationship with his partner, and in general health. And with the study, we have the different objectives. One of these is to know what is the cause of the infertility in those men, and to know if the cause of the fertility problem is reversible or if there is irreversible, and to find out if we need some assisted reproduction techniques like ICSI, or in other cases when there is severe problems, we could use heterologous insemination or adoptions. With the study, we could give to the couple genetic counseling and to know if there is any underlying diseases like cancer or immune disorder that could affect the health of those men. In cancer patients, there is a lot of fertility problems, and it is known that survival of cancer patients has increased over the time. Cancer per se could affect fertility, and this is caused by multifactorial problems. Treatment of cancer patients could affect fertility too. As you know, many patients could receive chemotherapy or radiotherapy, or they could have severe surgeries that could affect fertility in the future. So, for example, chemotherapy could affect spermatogenesis, producing spermatogonia toxicity. And the effects of these problems could be accumulative. The recovery chance of fertility is between 20 to 80% in some patients. Radiotherapy could affect DNA, and it depends of the dose of the radiotherapy. With low doses, there could be a deterioration of fertility, but with increasing doses of radiotherapy, there could be azoospermia that could be reversible or even irreversible. With higher doses of radiotherapy, there could be a damage of the Leydig cells affecting the testosterone production by the testicles. In this graph, we see with increased doses of radiotherapy, we could damage spermatogonia, spermatocytes, or even spermatides. And this could cause oligospermia, azoospermia that could be reversible or irreversible and could affect the fertility for a long time. So with every physician and every patient, with every physician and every person that treats people with cancer, we must recommend always cryopreservation before any treatment for cancer. That is very, very important in order to preserve fertility in the future. Even in children, we could perform cryobanking, that is to freeze testicular tissue in order to preserve those tissues in the future to get some spermatozoids to prevent fertility in children. Varicocele is a well-known cause of infertility. The scrotum has to be with a lower temperature compared to the rest of the body. The testicle needs lower temperature in order to produce spermatozoids. And with varicocele, the temperature of the scrotum is increased. So in this systematic review and meta-analysis, they show that early varicocele repair could improve the seminal parameters in most of the people affected with varicocele. Varicocele repair could increase sperm concentration, progressive motility, and normal morphology. So in every patient with varicocele, we must recommend early varicocele repair in order to preserve fertility. Also, with antioxidant therapy, there is some controversy about this item. But with this systematic review and meta-analysis, they look for a lot of studies, and they found out in 45 randomized controlled trials and more than 4,000 infertile patients that with antioxidant therapy, they could improve seminal parameters, diminishing the free radicals and preserve the DNA integrity. Some medication and drugs that we use for treatment of many diseases could affect fertility too. For example, immunosuppressive medication like sirolimus, cyclosporin, tacrolimus, or mycophenolate could affect fertility. And in those patients, we must recommend cryopreservation before the beginning of the treatment with those medications. With steroids, the literature don't support to stop the medication. With NSAID medication, we don't need to suspend those medications. Otherwise, with opiates, we must suspend the medication because this could affect the motility of spermatozoids and could affect fertility. Some treatment for prostatic hyperplasia could affect fertility. For example, finasteride could affect the testosterone production inside the prostate and could cause infertility. So we recommend to discontinue finasteride or similar medication for at least 4 months before the beginning of treatment of fertility. With tamsulosin, there is no recommendation at all. Anabolic steroids and testosterone could block the hormonal acts, and this could cause infertility. So we must stop those medications at least 3 to 12 months before fertility. And we must avoid any of these medications when we want to have children in the future. With diuretics, we must discontinue those medications, and the same with antibiotics like nitrofurantoin and sulfas. There are some general recommendations like to have healthy diet. We must recommend to our patients that they must eat nuts, seeds, fruits, and vegetables. They must perform exercise at least 3 to 4 times a week in order to prevent obesity and to avoid diabetes, hypertension, metabolic syndrome, and all those diseases. We must recommend to stop alcohol consumption, tobacco use, psychoactive substances, and steroids, as we tell before. We must have a healthy weight, sleep at least 7 hours every night, and manage the stress and the anxiety. And in every case, when we have doubt about fertility in the future, we must recommend cryopreservation. In INSER, we are ready to help you in any problem that you have with fertility. It's been a pleasure to be here with you in this lecture. Bye-bye.